injectable CBD tablet 3 times daily for 21 days. And Paula, while I'm presenting, feel free to comment, ask questions. Your mic is open. So what were the results of this study? No adverse events. That's nice. Not a single reported adverse event in the whole study, which is great. And I wouldn't expect that. 20 milligrams 3 times a day CBD is, in my clinical experience, rarely enough to make anyone feel like it's doing something bad to them. I think that it runs the risk of not being enough, not being strong enough for a lot of people. But every person in the study, all 31, experienced a significant reduction in overall pain. So we had 0 reported adverse effects. All 31 people reporting reduction in pain. Maybe some of it was a placebo effect, maybe not. A third of the subjects reported a very rapid response. So within 24 hours, they started feeling less pain. The other 2/3 observed noticeable change only about a week into the treatment. And there was nothing about their demographics or other characteristics that differentiated if someone was more likely to be an early responder or a late responder. So that's something that we don't really understand. All 23 subjects who were taking pain medications requested to reduce or stop their prescription, but were advised against it, so it didn't confound the results in the study. If they stop their drug and then their pain goes up, so they were asked to continue with all their previous treatments over the course of the 21 days. So here's what it looks like. How strong was the reduction in pain? So they divided into 2 groups here. The dark orange are those that are taking another pain drug, and the light orange are those that were not. But you see there's not much of a difference. Their average pain score was almost 7, 6 in the high 6s before the treatment. And at the end of the treatment, almost cut in half, so maybe about a 40% reduction in overall pain. And then if we look at their maximal pain score, you can see that that went down significantly too. So while some people were having kind of breakthrough pain symptoms above the average, up to like a 9 out of 10, you can see that that was not occurring after 3 weeks. No one was reporting pain greater than 6 out of 10. Also, anxiety reduced significantly, and we would expect this with CBD. So you can see these marked reductions on the Hamilton anxiety inventory. And then finally, sleep also improved. I think these results are really profound, and they use a sublingual water-soluble CBD. I doubt that that's making a huge difference. We're about to cover what that might mean. Why different delivery methods or solubilities of CBD could make a difference. But in general, I think that this is evidence that low or moderate dose CBD taken 3 times daily really deserves more clinical research in neuropathy and I'm sure other pain conditions. So really promising. And unlike many people's response to THC, you can see that a lot of the people had to take this continually before they started having the benefit. And I think that a lot of people that try CBD, either they don't try a high enough dose, or they don't try taking it for a consistent period of time to really evaluate what it might do for them after a week or 2. So that's the end of that one. Any comments or clinical pearls, Paula, when it comes to CBD, analgesia, neuropathy?
Yes, actually, I have a great number of patients that come to look for the benefit of neuropathic pain during chemotherapy. And what I see that the people, the population with diabetes or pre-diabetes, they have more vulnerability to have this neuropathic situation even with chemotherapy. And you can see the results, and I believe also that the measure of the pain, because if you are less anxiety and you are sleeping better, also the feeling of pain change, right? And this is the case that CBD is a multi-target. I think it's what is the best. That is this anti-inflammatory compound like action associated with anxiety and sleeping quality. So it's really having a great effect of those conditions.
What has been your clinical experience with CBD and sleep? Mine's been very mixed. You know, it seems to help
Mixed.
some, seems to maybe keep others awake, seems to do nothing. You've had the same thing?
Same. I think like what I see for those patients that they don't get sleep with CBD with normal doses like 50, 100 milligrams, we have to go for 400, 300, something like that. And even for some of them, it's not for everybody, I think, for the sleeping quality
I
specific.
agree. Yet, if someone is awake with pain in their extremities, and certainly my patients with diabetic neuropathy often report that it's most bothersome at night when they're trying to sleep. And so, if there is not just a pain relieving effect, but kind of an anti anxiety and neuroprotective effect, then I would expect over time their sleep to improve as it did in this trial. But you can see that the change in sleep was less pronounced than the change in anxiety scores. You can see that on the slide here. And I think a lot of the people that find benefit with using CBD for sleep are probably primarily having their sleep disturbed by anxiety.
Anxiety,
That's,
yeah.
yeah, that tends to be my experience.
Me
Great. All
too.
right. Well, let's move on. And big thanks to Deb Kimless and her team for getting this data out there. I think that is great data. The next is a study that compared 5 oral CBD preparations in adult humans, the pharmacokinetics, which means the study of how drugs are absorbed, metabolized, and excreted, body composition, and then heart rate variability, which is something very interesting. If you have not heard of heart rate variability before, it's something worth looking into because it's a great measure of overall health in terms of how the autonomic nervous system is working and what type of balance it's in. So basically, we think when we check our heart rate, we might say, oh, my heart rate is 70 right now. Well, that's an average over time. And if you were to look very closely at the time in between each beat, you would see that there's this fluctuation where the heart's beating a little bit faster and then a little bit slower and a little bit faster and a little bit slower. And that fluctuation has to do with the pulsatile interaction of the two branches of the autonomic nervous system, the sympathetic nervous system, which produces more of that fight, flight, or freeze response, and the parasympathetic nervous system, which produces more of that rest and digest response. And probably every chronic condition, or almost every chronic condition, has some component of it of autonomic dysfunction, where that system is out of balance. I mean, anyone that has hypertension or chronic pain or anxiety or PTSD, and you could go on and on, has probably some dysfunction in their autonomic system. And I think that that's mostly due to the fact that we are living in such a novel environment. And our sympathetic fight or flight system used to maybe be activated when a predator was attacking us, and that would not be a good time to eat and sleep and digest and so forth. But now we are, and so when that predator attacked us, it would also be a bad time to kind of think rationally and activate the cortical, executive thinking systems. Bad time for planning. It's basically a good time for an emotional reaction. Get the heck out of there right away. Well, now instead of having, say, a bear attacking us, we have our boss walking over to our desk while we're at work, and we're shifting into fight or flight. It's a different type of threat that doesn't respond to the fight or flight reaction. That type of threat would respond very well to clear, rational thinking, planning, communication, and not emotional reactivity. And so it's really, I think, because of our novel environment that it becomes so important for us to be able to take control of our autonomics and to be able to shift into a state of balance when we need to do that. And so heart rate variability is an indicator that's been studied in lots of conditions: heart disease, diabetes, chronic pain, several mental health conditions. And it shows that the people that have the better ratings of heart rate variability tend to have less severe disease, and vice versa. When heart rate variability is worse, that's a poor prognosis. The thing that a lot of these researchers don't indicate or talk about is that this is something that's absolutely modifiable, and that people can train themselves to improve their heart rate variability and really take control of their autonomics using biofeedback, breathing exercises, and so forth. And so this study was wondering, well, does CBD improve heart rate variability? So The other thing that I really like about this study is that it was done by a private corporation, and I am forgetting their name right now, but I'll get that for you. And instead of just kind of keeping this to themselves, they published it, and I really respect that. That's like in the, in the kind of collaborative mindset that cannabis so often brings to clinicians and researchers and patients and advocates and activists. And so I really love that they were just willing to share this with the scientific community, and it certainly substantiates the work that they're doing. So they used 5 different preparations that they made, and you can see some of the differences here. There was a CBD tincture base that was basically an MCT oil droplet with CBD isolate, and that was administered in water. I wouldn't expect that to do a great job of dissolving in the water, and it probably didn't. There was a CBD powder suspended in water, a 20% CBD liquid concentrate with MCT oil, the quillaja extract, which is basically an emulsifier. It gets oil and water to mix together. There was a 5% CBD concentration powder mixed with a few ingredients, nothing too profound here. Sorbitol, which is a sugar alcohol modified food starch, and so forth. And then the one that I highlighted here is the same one that you see on this chart at the top, really standing out in black. That's formula 707, which was a 5% CBD concentrated liquid with gum arabic, which is basically like a thickening agent, and a little bit of citric acid. And so it's hard to know why this one was so much better than the others, but as you can see, it absolutely was. This is the CBD concentration in the blood over the course of 240 minutes. And so you can see this real pronounced difference with formula 707. These 2 formulas perform similarly. That's 472 and 340. And then the other 2 did not perform very well. So this chart shows Tmax, which is the time to the maximal concentration. So a lower Tmax value shows you it gets into the blood faster and therefore is likely to have a faster effect in terms of relieving symptoms. And you can see that 707 was significantly faster than any of the others that they tested. Cmax is the maximal concentration. So how high does the blood level get when it's at its highest? And again, you can see here and from the chart on the previous slide that 707 was best and quite a bit higher than many of the others. And then AUC means area under the curve, and this is for the first 4 hours. So this is the total amount of CBD that's getting absorbed. And you can see here that the area under the curve for both 707 and formula 340 were better than the others. And again, it's not clear. I guess one of the similarities between 340 and 707 is that they both have these kind of emulsifying thickening agents, the quillaja extract and the gum arabic. So CBD, so the authors also mentioned that CBD bioavailability may be determined not only by the preparation or formulation, but perhaps also by body size and composition. They found some differences when they looked at the subject's body size and body fat composition in terms of how much they were absorbing. And then what they also found was that there were no real effects on heart rate variability. So probably still the best way to improve your heart rate variability is to take the reins and get a biofeedback device. I'm partial to the HeartMath company that's been making these devices for decades, and they're affordable and they're just extremely effective if you spend 10, 15 minutes a day practicing controlling your heart rate variability. I guarantee you'll get very good at it quickly and you'll feel better. So the CBD did not have much benefit there. But I wanted to also just look back here. Well, why don't we look here? And if we look at the total amount of CBD that was absorbed, the area under the curve, we can see that the lowest performing formula had about 2.3 area under the curve, and compared to the best performing, which is 9. So, we could call that like a 4-fold increase in absorption with this formulation. Now, every measurement in this study was performed under fasting conditions. And I've shown in previous webinars that the bioavailability of CBD increases by 4 to 5-fold when it's taken with a fat-containing meal compared to taking under fasting conditions. So what I don't want you all to leave here tonight thinking is, oh my gosh, I really need a formula with gum-arabic and citric acid in it because it's just so important for me to get the most bang for my buck out of CBD. I don't think that's it at all. I think that it's pretty clear that you can increase the absorption powerfully just by taking CBD with some fat-containing food. But I do love that this research is progressing, that companies are looking at basically how to make CBD more cost effective if there is a way to get more of it absorbed. Yeah, go ahead, comment, please.
I'm gonna add something here that it's I just recently I had a test and I'm doing with my patients of a pharmacology test to see how is the metabolization of THC and CBD in the body. And I recently discovered that I am a very fast metabolizer of CBD. So for me, I need much more doses than the normal people for normal conditions, for, I don't know, anxiety, let's say, for example, that people go well with 50 milligrams, 20 milligrams of CBD most of the time. I don't feel anything with 50, 20, 100. For me to start to feel something, it must be up to 100, 150 milligrams. So we have to add that also when we're looking to a patients, and we have just different also compositions and people and body types. And yeah, we know that all that affects, and the meal affects, but also the pharmacology, the genes of those patients also must be relevant. In the cases that cannabis doesn't work, when cannabis work, I don't test them, but in the case they don't, they have very significant side effects. What was like I was not expecting for example, for that milligrams or for CBD or something, I test them. And this is something relevant right now. We have this type of tests, so we can also know more about our patient related to the metabolization of these compounds.
And so those were genetic tests for your cytochrome P450 enzyme genes?
Yes, it's a test where they test a lot of polymorphisms also, and the vulnerabilization that the person have to have more symptoms related to THC or psychosis or types of different things we are not expecting for the food. Yeah, it's nice. It's really nice.
Yeah, I think that there's a lot of promise there. I see psychiatry starting to go there. There's at least a couple of companies here in the U.S. that are doing the pharmacogenomic testing prior to, suggesting that people get this tested prior to selecting a psych drug because it can indicate, likelihood of success and likelihood of adverse effects and rapid versus slow metabolism. And it's just part of the progression to personalized medicine. Thank you for bringing that up. Okay, so this next one is another small open label study in patients with Parkinson's disease. 13 started the study, but only 10 completed the study, and they were treated with high dose Epidiolex. So this is a mostly purified CBD pharmaceutical agent that's been approved here to treat a few rare seizure conditions. And they started at 5 milligrams per kilogram per day, which is a fairly high dose. So for someone that's 70 kilograms, for example, that would be 350 milligrams of CBD per day. And they were titrated up from there by 5 milligrams per kilogram per day every fourth day. So pretty high dose, pretty aggressive titration schedule, all the way up to the 20 to 25 milligram per kilogram per day range, if tolerated. And if not tolerated, they just maintain their maximum dose for 10 to 15 days. So what happened when patients with Parkinson's were given these really unaffordable doses of CBD? Well, you can look at their Total Movement Disorder Society Unified Parkinson's Rating Scale. So this takes into a lot of, many variables kind of all synthesized into a single value. And the average baseline was 43 with about 12 standard deviations. You can see how wide a variety of patients had in such a small group. And the final was around 35. So it was a net change of about 7, which is actually pretty good and, fairly statistically significant. Again, especially for such a small group, this data is suggestive that the very high doses of CBD did help them to some extent. However, there was no significant change in tremor, which is what the authors were hoping and suspecting that they would see the biggest change in, and that really was not impacted by CBD. Nighttime sleep improved, emotional and behavioral control improved. And this is the other thing that's so strange, and we've seen this with other studies of CBD in other settings, is that after stopping, they stayed on the CBD for about 2 weeks. Then they stopped the CBD for about 2 weeks, and a lot of those improvements were maintained even without being treated with CBD. Now, they did go back and measure their blood, and some of them had actually traces of CBD left in their blood 2 weeks later, but they were really low levels. And so I'm not sure that was responsible for it. I think probably what so many of us are thinking here is that maybe the CBD had a healing effect on the nervous system that promoted more of a long-term change instead of just a symptomatic reduction. But in my experience, I've found that Parkinson's disease may be somewhat distinct amongst the other neurologic conditions that I treat in my patients in terms of it being less likely to respond, especially to respond quickly to cannabis. I see many patients with Parkinson's, they sleep better, their pain is better, their mood is better, but their tremor, the bradykinesia, which means the slow walking, like basically usually the main reason they come in, which is to be able to, relieve their tremor, to move around better. And I don't see a lot of improvement there. When I do, it's often inhaled THC that gives the best results. And still there's some patients where that doesn't even touch it. And then I guess there's a small subset that will be not responding to cannabis early on, but after a couple months of consistent use for these other issues, then they start to see that their actual Parkinson's symptoms will improve. But I'd love to hear any clinical pearls, Paula, or your kind of a general experience with treating patients with Parkinson's.
The same. I think THC is killer for them. Like it's very necessary. The THC for control the disorder. I have the same experience of this results. CBD is very good for emotion and behavior control, but for tremors and what is the worst symptom for them, THC is the best to control that. I have patients that they vaporize and you can count like 5-10 minutes and then stop to shake, and they can even let off the, I don't know in English, you use for helping to...
The walker, the walking
walker, yeah, so they can even take it off. Sometimes they play, they walk with these tools here in the hand, and it's really impressive, the THC response.
It's fun when it works. It was about a year ago that I had a patient who was very reluctant to inhale the THC, so I had her come into the office and do it, in front of me. And we had her, kind of do some writing and draw some pictures before and after, and it was just a profound difference. And she realized that this was not such a big deal. The psychoactive effects seem scary to people who have never experienced them. But once they do so in the right setting where there's just, safety and reassurance, and now she loves it. There's no hesitation now. And it really, that's one case where it really helps her tremor.
Also, I realized that they don't need too much, so they can still vape small quantities, like 2-3 puffs, and they are fine with that. They don't need to go for like a whole joint or like they have the side effects of the THC. Like we can control the disease with low doses even.
I agree.
Is nice, yeah.
So then the kind of downside of this study has to do with the adverse effects. And so 5 of these patients had elevated liver enzymes.